This is IG Talanoa. It is a crossover from the Twitter Talanoa that I do every Mondays, Wednesdays, and Fridays on Twitter. But since there are a whole lot of people who are not on Twitter, I don't know why you're not on Twitter. You should be on Twitter. Anyway, hi, party all the time, Fiji events. Oh, party all the time, Fiji events. Hi, Alpha Tango Whiskey. Yandra Luke, Yandra my boy Mahi. So if you want to join me, please join me. I mean, as in send me a request to go live with me because I hate talking by myself on live. And so on Twitter, where I normally do this, people can join in and I can hear them and they can talk to me and they can ask me questions. So if you're sitting at home, please join me, send me a request to speak so that I can get you on and you can ask me questions before I go into what I usually do. So thank you for being with me this morning. Thank you for listening in. This is, like I said in the beginning, this is a crossover from Twitter Talanoa, and so I've decided to come to you guys first before I cross over to Twitter Talanoa. And so please hang on with me while I get my Twitter Spaces up and running. So if you are on Twitter and you prefer to go there, if you would like to be heard, that would be great. Yes, Maflele, are we starting the Twitter Space soon? Yes, we are. Hey, Quiviti, is that you, Apelli, or is that someone else in the Quiviti army? Anyway, hey, HNS Sustainable Fashion. Hi, everyone. I am apparently getting a call very early this morning, which I will not answer because I am talking to you guys right now. But if you're on Twitter, I'm just about to go live there now to start the Twitter Spaces. But until then, please hold on the line and please tell people about this Twitter Talanoa. So for those of you who don't know, tell people about this Talanoa. For those of you who don't know, what I do every Monday, Wednesdays, and Fridays is basically be available. I make myself available to people who have questions about the COVID-19 situation in Fiji or about other stuff happening in and around the news, because there's just so much happening. And you know how everyone was complaining that the government wasn't doing enough and all of that stuff. A few of us decided a few weeks back that you can't put all of the burden on the government. There are many of us out here with so much following, so much influence, and with platforms like this that have 2,000, 3,000 people watching, and so we should all do our part. So this is me doing my part. If you have questions for me, please send them via inbox. I can't guarantee that I'll always be able to see it, because this is something that I do on Twitter more than I do here, but I am setting up my phone right this minute while I'm talking to you. And so if you have your questions, you can send them on, you can DM me and I'll be able to answer your questions. So we're going live on Twitter Spaces right now. So if Twitter is your preferred mode of Talanoa, please feel free to join me there. Otherwise, I'm happy for you to send me your questions right here on Instagram. And so I am now positioning all of my 10,000 phones in front of me so I can get your questions. Otherwise, please hang on for a little bit. I'm going to play some music, or rather I'm going to ask my daughter to play some music. Please, daughter, because that's something else that I do on Instagram. On Twitter. Okay, 5 people listening in. Please bear with me for just, a minute or two while I get other people online. Okay, so do you like my earrings? I really love them. These are from Amimono Pacific. I think they're based in the West, but you can find them on Instagram. That's where I found them. And what I really like about these guys is that, look at that, if you look really closely, otherwise I'm going to post it on my wall later. This is Masi, and I'm feeling very fancy because I've just got a plain turtleneck on. So I'm putting on this beautiful Amimono earrings to kind of glam me up a little bit. I don't wake up looking like this. I am looking like this today because I have already done 2 jobs this morning. I went live on radio and on TV in New Zealand, and I normally don't look like this. One of these days when I have more confidence, I will put up a picture of what I actually look like every morning. Otherwise, please hold on for a little bit while I get my friends from Twitter to join in on this Talanoa. But otherwise, can I ask for somebody to join in and join in my live and have a Talanoa with me? Anybody, really, anybody. Look here, if you can, send me a request to join so we can have a good Talanoa. Oh, hey, Sikeli. Now I can see people. Kuiviti Pacific, did you just call me Polly? Like Polly looking? Or is the Masi more Polly? Yandra Tua, how are you doing? Please send me a request to go live with me. Oh, Kuiviti is saying, love the earrings. They are Polly. I don't think they're Polly. I think they're very Melanesian. Let me have a look. Let's see. No, they're definitely Fijian. Oh, hey, I am seeing some people joining me now on Twitter Talanoa. Hi, Twitter Talanoa, folks. Hey, Shah. Hey, Minnie the Cow. Hey, Tex Geek. I want to have a fancy handle like that on Twitter, but I can't because in order to get verified, they wanted me to use my real name. So Tex Geek, I love your name. Hi, Naikaso. Please share and tag a tweet about this Talanoa so we can get more people on here. Otherwise, hey, Twitter people, you are now coming into a live conversation that I'm already having with friends on Instagram because I'm trying to take across our Talanoa onto my other socials. So I've been talking to Epeli of Kuiviti. I'm talking to Israeli Mainuvuke of Tour Music Fiji, and Sikeli Mbaravilala, who is in Taveuni, Jed Taylor, only one of this country's best dancers, and a few other people who are joining me now on Instagram. Oh, hey, Rotsikeli, nice to see you there. And Maflele and Mariani and Lukinade of the Fiji Times I have already been live with me online on Instagram Live. So you folks on Twitter are coming on second. So as soon as I can get more people listening and have this broadcast stable, I'll get right into the news and talk about our what shall we call it? Well, we've been calling it record breaking. Every time our case count becomes more than the day before, we call it record breaking. But yeah, I don't actually have a proper word for how to refer to 1,220 new cases, because we went right past the 900s, didn't we? We went from like 800 and something. I forget. I've stopped looking at the number of cases about a month ago. I've just been focused on the number of deaths. And so, yeah, we went right past the 900s. We just went from like 800 straight into the 1,220. So I literally like yelled when the figures came out last night. I actually yelled out. I was pretty shocked at how bad things are for us right now. Anyway, so I can see that we are coming back online and the broadcast is steady both on Instagram Live and right here on Twitter Talanoa. So let's just get right to it. Please, you know the drill, Twitter folks and Instagram folks. You probably know the drill better than me, because this is probably only the third or the fourth time that I'm actually going live on Instagram, and only the second time that I'm going live on both Instagram and on Twitter. So do not be fooled by the glamorous exterior, because I am so nervous right now. So So Epeli or Rocky or whoever is out there and can join me in and have a conversation with me just to make me less nervous, I would really appreciate that, and probably do something nice for you, like send you the donut that my daughter Esther and I are going to make after this. Anyway, stop being nervous. Let's get right into the news, because then I will be less nervous. So we now have 9,468 cases in the month of July alone. And the month of July is only, 16 days in. 15 if you count exactly where these figures have come from in terms of the government surveillance. So 15 days into July, and we have 9,468 brand new infections. So in the entire month, in the entire pandemic leading up to the 1st of July, in April on the 15th, when this outbreak first started, in May and in June, altogether, the number of cases were 4,267. And last night, we've doubled that. We've more than doubled. In fact, it's 2.2 if Excel formulas are to be believed. We've doubled it by 2 and a bit. And in the number of deaths, we had 21 deaths from March 2020 to the end of June this year, 21 deaths. And as of last night, we've had 53 deaths. 53 in the month of July alone. And I keep saying the month of July so we can bring some perspective into the situation that we have, because the month of July is only gone 15 days in. We're only halfway through the month and we already have 53 deaths. So in total, we've had 74 deaths from the pandemic since this whole nightmare began in March of 2020. In the month of May, we had 2 deaths. In the month of June, we had 17. And in the last 2 weeks, we've had 53 deaths. And earlier in the week, when I started doing those little videos, infographics that I put out on my Today Media Fiji platforms, I had said earlier in the week, because we needed to look at the numbers, and Marlon will tell you, and my friend Miliki, who actually is my manager, will tell you, I can't count to save my life. I'm one of those people that really literally needs to hold coins like that in order to do my maths. So I've been looking for people who are great with numbers, love numbers, or statisticians, as my mother told me is the proper term for the kind of people I'm looking for. I was looking for statisticians who can help me understand the numbers and maybe make projections in terms of what do we have ahead of us, how bad is the situation ahead of us, because I was hoping to be able to use those numbers to talk to you, to talk to whoever thinks I'm worth listening to about doing something. Because like the Ministry of Health has been saying from day one, we all have the ability to do something about the situation, and that doing something is vaccinate. But I know that is a contentious issue that all of us really need to dialogue about properly. But that is the one thing that is available to each and every single one of us. And another thing that is available to each and every single one of us, but has less ability to control the situation, is just following COVID safe protocols. Like, my chief, the Turanga Mbalinatuidakau, said on the Vakondrove COVID-19 Talanoa that we had a week ago now, he said, "Oi avatiau, en duanga ondaritami, mam endarbarorongo." He said, translated, you and I, there is one thing we can all do. You and me, we can just comply. Well, actually directly translated, what he said was, you and I can just listen. But in the context of Vasavakaviti, what that means is, what he said was, you and I should just comply. Yeah? So let's just follow directives. Let's follow instructions that have come from the government about being careful, about being safe, about staying safe. And I think that information has been pushed out from the very beginning. So one of the reasons that I do these Talanoas, even though contrary to popular belief, I am deathly frightened of broadcasting, I don't like cameras, I worked for 20 years in this industry before I gained the courage to be in front of a camera. And honestly, when I come in this morning like this, it's still very scary for me to be seen this way. But the makeup was already there because I had to be on TV. So I thought, hey, what the hell, let's do it. You and I can do this. We can use our voice, we can use our faces to talk to people, to help people who don't understand how critical it is that we stay in our homes. Or for those of us with access and with the privilege of being able to shop, how critical it is for you and I to reach out to those gang who can't make ends meet, who don't have jobs right now, who can't put food on the table. And so, because I just don't believe that people are still gallivanting around the place for the sake of gallivanting. I think that we're all sufficiently afraid of what's happening around us. I mean, 1,220 cases, right? No one doesn't know to be afraid. We're all afraid, but we all deal with fear and all of these extreme emotions in different ways. And so if we're all frightened, but some of us gang are still roaming around the place, you have to start thinking from a place of respect. And this is something I've been pushing for the past few days. Just back up a little bit on how we feel about vaccination, how we feel about the government, how we feel about the other side of the government, how do we feel about the opposition, how do we feel about anything really. Back up a bit, because we're we're basically, when they say when shit hits the fan, yeah, we're there, we're in the shit hitting the fan moment. When that happens and none of what we've been doing is working, or none of what the government is doing seems to be working, you have to step back a little bit and think about, how else can I approach this? How else can I have these conversations with my people? How else can I talanoa to the gang who are still gallivanting around the place? I'm convinced that it's respect, and I believe this. I feel this way because I've worked in public health in the past, and one of the ways that we talk to people when we're trying to get people to comply is using communications that's aimed at changing behavior. And the philosophy behind behavior change communications is respect for the people that you're trying to communicate messages to. And so I just want to encourage all of us here, because it's the end of a really terrible week and it's the middle of what looks to be a nightmare month. July is a nightmare month. So my big message, if you'll allow me to give you a message, is that let's have a little bit of respect in the way we talk to our people, because it's now a matter of life and death. Let's have a little bit of respect in the way we talk to people whose views are so different from ours. Like, I'm seeing people online saying stuff like, io che mi dà si vede lo cingorri, non sa mo se non lo mondo, cosa non tavela mondo le vole pena dondo, cosa non tavela mondo la vana funi wai, o che mi dà una sang cingorni vedula. Nangona kaya mando sa sudumikina na luvi mando ko sa ndo to vale melak meledula and all of that stuff. But you know what, that doesn't help. That doesn't help, because it's not that they don't believe in Western medicine. We are a very sophisticated country relative to the Pacific in terms of our public health infrastructure, in terms of the access to services, in terms of access to medical care. We have the best in terms of how we have the major hospitals, and then we come down to the health centers, and then the nursing practitioners, and then the nursing stations, and then the village dispensaries, and then the nasivakoro, and all of that stuff. We have the access. Our people have had this access for generations, for at least since I've been alive, and that's been more than 4 decades. So it's not that we don't believe in Western medicine. We have managed to come to a good balance between appreciating our own traditional remedies and also understanding our the Western medicine and the Western healthcare that's available to us. I mean, we have the only medical school in the entire region, and it is, what is it, medical people, 150 years old? So I just don't believe that there are people that think that medical care is, from the devil, or whatever it is that people believe. So I'm convinced that it's about dialogue, that it's about helping address people's fears, helping to address people's confusions, and just not shutting off, the lines of communications that we have with people. So, if you understand it, okay? If you're talking to people, sorry, my bone can be a little bit broken, so let me just speak in my dialect. Eva ando ilain dua sini bedula ererch embe adula ni bebasa ni dela ni ro ni bebasa ni dela ni loloma ni bebasa iba vewe ani balata matengo eva anda sini bebu ina na lebu saranga bi enda ai tau ena mate balata ngono sarama tangango a leilai wili ni tamate relachi ani merli dula esa leilai sarchanga enda tau a wil ni tamata sarayada ci ani balimbula sarayada ngayani ramate sa mate tu yani se sindende an ci balimbula rangarabi ci ababuni wai sarame lenga sa lebu ci angabi enda tau sa saranga bambimbi men de bebesa inandela ni loloma men de bebesa inandela ni ro because that's who we are as Fijians, you know. Respect is the crucial, the very basic foundation of who we are. So let's do that. Let's call our people back home. I've been doing that. I've been calling my tatalilais and my nays, interviewing and talking to them about and normally we will have about 4 or 5 conversations before they say, okay, set but you know, I have the odd uncle who will be like, XYZ, and then he lists down the conspiracies, and then I try again. So let's try again, because we jumped from the day before was, oh my goodness, I keep getting a call, and sorry, excuse me while I decline that. We went from 873 was our biggest case count, and that was on the 12th, 3 days ago. We went from 873 cases, and then we dropped down to 647 and 634, and it looked for a little bit like things were going good. And then we jumped right up to 1220. We went right past the 900s and went right up to 1220. So 1,220 cases, 5 deaths by COVID, 2 deaths by other illnesses to people who were COVID positive. And so that means that right now there are 11,033 people living with COVID-19 in this country. And in total, we have had 13,886 cases since this nightmare began in March of 2020. But you know what? In this pandemic alone, which is only April, May, June, July, which is only, what, 4.5 months? Is that 3.5? 3.5 months. We've had 13,816 cases. So there is no room for us to be making mistakes about the way we talk to our people. Yeah. E sandun donu sarangabi enda kere na ngono sarangango menda torva malua anda bebasai batira sianga chio ni bedula na torva malua menda bebasai babina bala tamate sa yado sartungango na bisinga tamata saramate tu sabe atolu le tolu average average rolling day average for the past 7 days tunira ni sa lewe tolo tamata saramate sarch angango na bisinga nisinga rua sauchi lewe tini rawili imainir samate yama tini spread out over 5 days nambongi saramanda nga ortu lewe 5 ma and bambali na noche nga ortu lewe 5. I mean in the 24 hours up to yesterday morning ortu sa lewe 5 ortu samate. So sa sarangabi ende kirkeda barong chumingo vambimbi yo emni Talavonia emni omai palangi emni varong chumingo ningiri bali ningiri na oro ni bebasai yo saranga anda bebasai me bulia nandela ni loloma anda bebasai me bulia nandela ni ro baleta anda bambo tendindui aya londa tendindui abano enta tumbermi ina tostos ni anda bakasama anda reni wili ai solibi enda tundui balebu menda Talanoa nandela ni loloma Talanoa na toso babina. I think we can all agree with that. Everything that is based on love and respect and patience and tolerance and understanding, they have a much better chance of being effective from a communications point of view. But I think from just being human point of view. So let's do that. Let's talk about COVID-safe protocols. Let's talk about vaccination from a point of respect and love and understanding so that we can get more of our people to be protected. So On that note, I have now seen some questions coming through and lots of comments. So to everyone commenting, saying hi and talking about my beautiful earrings from Amimono, thank you very much. And no, I don't look like this every day. So on the days when I look like this, I take lots of pictures for proof because this is not my default setting. Anyway, Mrs. Big Bold is Sai Vetata, and for those of you on Twitter, Sai Vetata is joining me on Instagram Live, and Sai, of course, is a super brilliant, super smart a woman. She's a scientist. She's based in Japan with her husband, and the two of them working in fields of scientific research that even I don't fully understand and will need to read about for a long time to be able to talk about it confidently to you. Suffice to say, they're super brilliant people working on their PhDs, and she's telling me, Livia, thank you for doing this. It's helping me understand what's happening on the ground at home. So thank you very much, Sai. I appreciate that. Thank you for joining in. Congratulations for getting the stats down, Marlon. Me getting the stats down? Or you mean like writing it down? Or it's Excel, that's not me. I can't count to save my life. I wonder how much longer Fiji has to go before Fiji's numbers peaks. Thank you, Sai. That was a question that I was asked on Radio New Zealand's morning report this morning, is have we peaked yet? And all indications are that we haven't. In fact, we should be very close. Dr. Fong had been talking about peaking as meaning at the risk of not being too alarmist, because I do want you to know the facts, but I don't want to alarm you too much and unnecessarily, is that we're heading there. More people will die on a daily basis at our peak. Yeah. So how much longer do we go before Fiji's number peaks? Sai, I think we're a few weeks away from peaking. Oh, True Colors Vanuatu. Hey, Harrison, how are you doing? Another question. 8 weeks before we get 80% vaccinated, from Marlon. Oh, right. Marlon is responding to Mrs. Big Boat or Sai to say that we're 8 weeks before we get 80% vaccinated. While the numbers decline, the deaths will continue. I don't know about how far along we get before we can get to 80% of our target population vaccinated. I've seen a few people throw some numbers around. I am not too happy with the growth of our fully vaccinated population. I think we've been moving a little too slowly, which is why I think these community communications initiatives are really important. We need to be talking to our people directly because they need to be hearing from people they trust. And unfortunately, I just don't think that they trust authorities too much. For various reasons. So let's get out here and let's talk to them ourselves. I know from having talked to the Minister for Health the week before the outbreak is that they had dedicated the entire year to getting 80% of our population vaccinated. But that was, of course, before the breach of protocol at the quarantine facility in Nandi. At the time, though, when I asked him, why do you think it'll take you the whole year? One of the very important reasons had been in the issue of supply. First of all, we get our vaccines for free. We get them for free thanks to our friends in the European Union. So if you're in Europe, thank a European today. It's their tax that's paying for our vaccines. So they supplied the first 20%. So that's 20% of our target population that the Europeans have vaccinated, and that came out of what's called a COVAX facility. So Google those guys so you can learn about it, so you can know who to thank when we get to the numbers that we wanted in terms of vaccination. And the other issue is that when these vaccines come, we have to be able to store and distribute. And so that's why I don't believe we will get to 80% in the next 8 weeks, because our frontliners are getting sick. Our frontliners are exhausted. Our frontliners have not seen their families for weeks and weeks and weeks because they're working all the time. First of all, I don't know how many of us know that doctors work 12-hour shifts as like a default setting. That's their default setting. They work for 12 hours. They're on call for 24. And nurses also work for 12 hours in normal times, or in peace times, as it's called in the crisis management space. So right now they're working much longer hours. I've been getting calls from doctors, nurses, lab technicians, orderlies, who are talking about being so exhausted they're working like robots, who are talking about surviving on a packet of potato chips a day because meals get missed for various reasons, some of which I reported on. Kitchen staff are getting sick, not enough food to go around, or you work so hard or so long that you miss it. So if you're doing grocery shopping today or tomorrow, and you know a nurse or a doctor that is in quarantine while they're working right now, send them a care package. I do that for a nurse that I've been worried about. I just call her and ask, hey, what are you missing? Oh, I run out of this, I run out of that, but it's okay, leave it, I'll buy it. And I'm like, no, don't worry, just tell me the safe place to drop it off and drop it off. So do that, support them that way. But my point is, our frontliners are exhausted. So if they're exhausted, they're not moving at the speed with which all of us hope they're moving at. And so they probably not going to reach 80% in the next 8 weeks. I don't think so. I just think that is a ideal situation we all hope for, but will not get to easily. Our soldiers are also tired. Our cops are also very tired. And they're also dealing with increasing numbers of infections within their workplaces. So do what you can to support a family or a frontliner today, a frontliner family or a frontliner today. So first thing, if you know people who don't want to get vaccinated because they're confused or unsure or unaware of the facts, please talk to them from a place of respect and a place of tolerance and understanding and love. If you know a frontliner, if you know a civil servant, period, just assume they're a frontliner, because a lot of them are working in spaces they can't talk to us about. So help them out, okay? It can be in the form of lunch for that day, or it can be in the form of, like, for me, in my case, it's bathing soap and toilet paper that I'm sending in the care package today. I will throw in a chocolate too, but there are little things that you can do that don't cost all that much, that can support the response today. Our numbers are probably going to get worse because I am understanding, which is a journalist's way of saying, you can't really quote me on this because I have to verify it. I am understanding that our testing is also lagging behind. We're not getting as much samples running through those test machines as we would like. They're running a little bit late in terms of maybe a day or two. I'm getting confirmations from Dr. Sahukan and Dr. Fong in the next couple of hours, and then you will see that story coming out on Radio New Zealand. Sorry, let me just decline this call from my son, who calls me every morning to say good morning, and I have been working since 6 a.m. So he's probably wondering what's wrong with me and why I haven't answered the phone. So anyway, the testing is running late, so you can expect that the numbers will go up for at least, my own assessment, for at least another week or two, at least until the end of this month, before we can hope for some change. But don't sit around waiting for that change to happen. There's lots you can do. There's lots you and I can do. To quote Turang Banglatuidao again, "Oi obatiao chi anda ritabi, oi obatiao mate mandangani anda ritabi mendaro rongo." Nisa erema ya matentu menda chavandu ivale, nda chavandu ivale. Nisa erema ya matentu menda lidula nda lidula nda tale rawa. Nisa erema ya matentu me kua manda une angona sa seranga kua une angona. Or drink grog on your own. Or be like me and just vasata because you don't know how to loss your own grog and therefore can't drink grog. So drink tea. Doesn't do the same thing, but Use your imagination. That's what I've been doing. It's working for me. But yeah, sometimes wine works too. Speak to people about how important it is that we talk to each other in the nicest possible way, that we be kind to each other in the next few weeks, because it's making a difference in our ability to get through to people to change their behavior and stay at home, or to go and get vaccinated. Okay, so I have some questions coming through, and well, they mostly all look like comments, and a lot of them are people asking me about my earrings. Okay, I will tell you about my earrings later. But hi, Litia. It's so nice to see you here. So Litia Cohen, everybody, if you're paying attention to the situation with our moms, with pregnant moms and with new moms who are COVID positive, they are one of the biggest numbers. They make up one of the biggest numbers. In fact, I'm writing a story about where the big numbers are coming from in terms of severe cases, and it should be on Radio New Zealand in the next day or two. But basically, in the entire pandemic leading up to about a week ago, there had been 150 positive moms. So you can assume that's moms with their babies. And at the Makoi Maternity Hospital, there had been lots of issues with moms not getting food for like a 24-hour period, or getting it late when it did come, and no hot water with which to shower or with which to bathe their babies. And these things were very critical. They were washing their clothes in the cold water in the sinks next to them. And so we've had a lot of wonderful community support in terms of the International Women's Association, and now in terms of Litia Cohen. So her handle is at Litia Cohen, and she's here on Instagram. I'm not sure if she's on Twitter. So Litia, if you're on Twitter, please just stick your handle on my IG comment section so I can tell people. So Litia is part of a group of people who are trying to raise funds to support maternal child healthcare, so to support pregnant moms, to support newborn moms, and newborns who are directly affected by the pandemic. So please look them up so you can support this initiative, because this is another one of those community initiatives that's doing really good work and making a difference. And like I said at the beginning, we're at that part of this crisis where we all have to pitch in. Our government, no government in the world, let's just say that first before I talk about our government, no government in the world was prepared or was ready for something like this. And so our government definitely was not. And they're struggling right now, in case you still don't know. So we need to pitch in. There's so many of us that can do a lot of things. And so please support initiatives like this one. Litia's comment is around 30% of our urban community population surveyed have indicated they are awaiting vaccination. Are there any barriers to vaccination outside of money for transportation? Litia, that's a really great question, and thank you for bringing that up. First of all, there are people who are frightened of catching the virus in a crowded situation. And unfortunately, some vaccination centers have been notorious in terms of people's non-compliance. People are still crowding up, people are still getting into people's personal space, going past the 2-meter mark. People are still not wearing masks properly. And so there's a big fear around that. And that fear also applies in terms of screening facilities. There are people also, I think another one of the barriers to vaccination is that there are people who are being pressured by those around them in terms of their beliefs. But in terms of actual logistical barriers to vaccination, I think money for transportation is pretty much one of the biggest issues here, because we're constantly telling people, go and get vaccinated. But we're like, how are they going to get to these places though? We haven't talked about that. We haven't talked about and when you have restrictions on public service vehicles in terms of how many people can get into one of them, these are real issues. So thank you for bringing that up, Litia. I will push that some more. So if you want to reach this particular MCH Maternal Child Health Care Initiative. Lithia Cohen is on Twitter as Loving Islands, so that's at Loving Islands. Fijian Warriors is asking, can I have your number? Can you have my number? Yeah, you can first DM me what it is you want to talk about, and then yeah, we can exchange details and talk to each other. Otherwise, let me just check if there have been anything come through on my DMs on Instagram. The Twitter platform is a little bit quiet this morning, but if you have questions, I'm happy to take them from anyone else. And sorry, I'm a little bit new to this whole Instagram request to join each other, be live with each other kind of a thing. Oh, okay. I apparently have lots of comments on my Instagram. None of them relating to the topic at hand. So yeah, we will not talk about that. Thank you very much, everybody. And on Twitter, Lithia is at Lithia Taukave. Please check her out on Twitter and support that program, because a large population of people who have COVID-19 right now are people who are moms, expectant moms and newborn moms, and a lot of them need the very basic of things. Oh, hey Lepani, I just see Lepani Rayala joining us. Hey Lepani, are you still at a COVID care facility, or are you at home? I just want to send some love out to Lepani, who lost his partner to COVID over the past few weeks, and who had to watch her funeral via Zoom. I can't even imagine what you're going through, friend, and I hope that you are feeling better. I hope also that you have support. Haley there, I have been discharged. That's great to know. Okay, Eurotumen friends of mine who are speaking to me in Rotuman. I want to learn Rotuman, but aside from Noia and Faxia, yeah, I'll stick to learning it from getting it translated from my Rotuman friends. Anyway, that is all I have for you this morning. We have now gone almost an hour, and unfortunately I have to leave quickly because I have some very important donuts to make for that son of mine that keeps calling me. And the daughter that I promised I'd make donuts for this morning. I've never made donuts, so if you have a great recipe you want to share, I'm very... Lithia can teach me what, Rotuman or making donuts, Marlon? Maybe it's both. Anyway, you have a good morning, you have a good day, and I hope your weekend is one that is safe. I hope also that you remember Mrs. Big Boat is saying, for today, they're looking forward to more of this. You're so welcome, Sai. And thank you to the people who have been listening in via Instagram Live. I normally do this on Twitter every Mondays, Wednesdays, and Fridays. This week, I did not do Wednesday because I had a lot of work to do that morning and I basically couldn't get my act together. But on Mondays, Wednesdays, and Fridays at 8:30, going to 9:30, sometimes we go all the way up to 10, sometimes even 10:30, we have a Twitter Talanoa where we address some of your confusions, some of the technical information coming out of the Ministry of Health that may be a little bit difficult to understand. And we also just have a Talanoa about coping with COVID. Usually on Fridays, we have Selena Kuruleva with us, and she takes over the show and helps people to cope with COVID. But Selena was helping me cope with stress basically over the past 2 weeks, so I thought I'd give her a rest today. So just a big shout out to Selena. She doesn't just help with your mind, she helps with the body too. Sent me some honey, noni, and ginger to get myself out of very, very bad dose of the flu. No, it wasn't COVID, but yes, I will get swabbed anyway, because that's what you should do when you think you might have caught it, is get a swab. So until next time, just to quickly go over the stats again: 1,220 new cases, 5 deaths yesterday alone. We've had 72 deaths in just the last 3 months. We have had 9,468 brand new cases in these first 2 weeks of July. Yes, 9,468 new cases just in July. We have had 74 deaths in total, and 72 of them have been from this outbreak alone, which started in the middle of April. Our biggest number of deaths reported in one single update has been 10. We've had 10 deaths, but they were not from the same day. They were spread out over a 5-day period. But we have now passed, we've well past the 11,000 mark in terms of the number of people currently living with COVID-19. We have 11,033 people in this country living with COVID-19. And as I understand that, that's a couple of thousands, maybe several thousand of those people who are COVID-19 positive are on home isolation. So be very careful about your movements, because as you would have seen on social media, there are people who are COVID positive and who are meant to be staying home who are not staying home. I'm working on a story right now and talked to Dr. James Fong last night, who confirmed that they have had to file complaints with the police about monitoring people who are meant to be on home isolation and aren't. So what that means for you and me is exercise absolute caution in just not leaving your home. If you can't stay home, if you need to go out and buy food, please think about using online services, especially if you can afford it. If you can afford the extra $5 that Arbi Patel charges when you live within a couple of kilometer radius, if you can afford the extra $10 or $15 to have Arbi Patel deliver to you, or MHs if you like MHs, I don't, but use it, because that means that the crowds in those supermarkets where the majority of our population go to are that much smaller, and that makes a difference. If you don't have to leave the house, if you can use internet banking, if you can pay your bills using the phone, using the internet, please do that, especially those of you who have that privilege and that access. If you have money in the bank and have extras, check your weakest link. Check within your community, check within your family for those people who can't afford to put food on the table, and send them a care package today. On that note, I hope you have a wonderful day, wonderful rest of your morning, and a good weekend. And please DM me, give me feedback on how this went, on how you think I could improve it, and also send me questions, things that you're confused about, or things that, even if you just want to vent or rant rather, but maybe less of the ranting, more of the venting. Tell me, what is it that's confusing for you, or what is it that's difficult to understand, so we can talk about that, so I can get you some answers, because that's what I'm here to do. We do these Talanoas on Twitter and Instagram, and eventually I'll do it on Facebook, and if I can get 1,000 followers on TikTok, I'll do it there too. The idea is to just be available to those of you who want to talk and who want to clarify, so you can go on and do the same for somebody else and pay that goodness forward. Have a wonderful day. Vinavalevu.